contaminated Hammanskraal water, which led to a cholera outbreak, underpinned proceedings ahead of the budget speech in the Tshwane Metro. Drama erupted minutes before Finance MMC Peter Sutton geared up to deliver the municipality's 2023-2024 budget. The FF stopped him, demanding the DA-led coalition take accountability for the multiple deaths caused by cholera, and also wanted the mayor to drink the contaminated water. This comes after Tshwane Mayor Silius Brink confirmed that the city's tests found no traces of cholera in the Hammanskraal water, but Brink refused to drink the water to prove that the water was cholera-free. The disease has already claimed 17 lives, while many other people are still being treated. All right, let's discuss then the situation in terms of how healthcare workers are coping with the crisis in and around the affected areas of Tshwane Metro. We are now joined by Health and Allied Workers Indaba Trade Union President Rich Sicina. Rich, always a pleasure to see you, sir. Thank you for joining us.
Thank you for having us. Salute.
All right, let's talk about it then. I mean, how exactly are you being equipped at this time? I mean, government has made claims that, they are equipping you to better deal with the cholera outbreak. What has been the actual experience on the ground? And what exactly, are the needs as this time, of course, as the number has increased at this point?
What we are actually facing on the ground is demotivating. It's tiring sometimes to always complain now and again. It looks like those in positions of authority in our country, in particular in the Department of Health, didn't learn anything from COVID-19. By now, we should have at least having a contingency plan to prepare ourselves should such outbreaks or pandemic like this, more especially from COVID-19. Because what is actually happening in Tshwane is that patients are admitted in Jubilee Hospital because this is the hospital that is actually admitting since this outbreak happened around Hammanskraal. So the biggest challenge is the one that we actually always talk about, the gross shortage of staff.
And I was actually going to go there. I was actually going to go there, Rich, because the last time you and I spoke, I think it was a commemoration of International Nurses Day. And one of the factors that you highlighted more than anything was the issue that you are understaffed. And, I tried to address it with the Deputy Minister of Health, and he said that they were looking to indeed address that, given that there is this cholera outbreak, and of course fears that the numbers that have risen will continue to rise. So, I mean, you're saying it's still the same situation, that the numbers are just not enough in terms of nurses and staff on site.
The numbers, even the numbers of death, we are actually talking about it as an organization today to say, do you think the numbers of death, that because they are still they keep on piling up, is it because maybe they are not equipped or proper, fresh healthcare workers on the ground who are nursing these patients? Because what is actually happened is that Jubilee Hospital and George Mokari Health, they have decided actually to open wards, new wards that are going to actually deal with these patients. But now the biggest question on the ground is who is going to nurse these patients? In the absence of the best, unfortunately, mediocre becomes the best. It's the same nurses who are underworked, who are overworked, who are understaffed, the same doctors, the same healthcare workers who are actually supposed to go to those new opened wards to actually nurse. So healthcare workers were all up in arms in Jubilee. As health and allied workers in the trade union, we had to go there to say what is actually happening. Nurses are saying we are absolutely tired and exhausted. We can't be facing this particular pandemic, and the department doesn't have a contingency plan, while we have a lot of nurses who are unemployed. And we even spoke to the CEO of these facilities to say, what is actually now your problem? Where can we assist as an organization that defends workers on the ground? Now, what came out clear is that we have a challenge of gross shortage of staff and gross shortage of material resources. And the MEC, fortunately, was there in Tshwane Jubilee Hospital, but still now there's only what there's an idea on the ground to say we are going to have a contingency plan. We are going to call some healthcare workers. You talk about your doctors, your porters, your general workers, your nurses, like we did with during COVID-19.
Yes.
But as the MEC, Rally Huku, I'm still going to go to the premier of the province, present this problem to the premier, and then we are going to come later and give you, the CEO or the management of this hospital, a go-ahead to say call all those healthcare workers under a 12 months, and will give them a 12 months contract. I am telling you that we were supposed to have done that long time ago by now.
Yeah. When you talk about the material resources that, there's a shortage of, to what exactly are we talking about? I'm trying to get an understanding of, what goes into the treatment of someone with cholera. What are you short of? I mean, during COVID times, we knew that, there was a shortage of, certain materials that are needed, masks, things like that. But when we're talking about cholera, what shortages are we talking about here?
Some of these persons, okay, first of all, the basics like for us to be able to diagnose these patients properly and able to, so that we can be able to give them proper treatment and stuff like that. We need your BP machines. We need your SGT machine, those machines that we use to check blood sugar level. And in the situation we find ourselves in is that everything we need to go to other wards and actually borrow those particular machines, and the word that you are going to go and borrow those machines is actually going to come back after an hour or so to say, can you borrow us back that particular machine because we want to use it as well. Other patients, remember, when this sickness is progressive, as it progresses, others need to be given another chance by taking them to ICUs, let them be ventilated. But then what do you do when the ICU in the hospital is full?
Yeah, and are you
finding
there's
nowhere you are going to there's nowhere where you're actually going to take them. You are actually going to do your best and watch them dying in front of your eyes.
Yeah, and let's talk about the issue of admissions. I mean, in the beginning, I think when, we weren't aware that the cholera outbreak is this bad, obviously there were a lot of admissions. Are you finding that maybe the numbers are slowly starting to decrease, or are you finding the opposite in that more cases are starting to present? I mean, what are we seeing?
That more cases are actually starting to come into the party. That is why we were, as health and allied workers, health and allied workers in the World Trade Union, talking to the MEC to say, let's have people on the ground. Let's call all those unemployed nurses and healthcare workers in particular who were released at the end of their contract, COVID-19 contract. Let's call them, because the number, as soon as the number increases, the number of deaths increases. As soon as you see the number of deaths increases, and we are kept on being told that now it's 17 people, tomorrow it's going to be 21, that other day. It is because people they keep on coming. That is why there is a ward that is actually have been opened in Jubilee Hospital and also in George Mukari Hospital. Maybe if George Mukari can't take it anymore and Jubilee can't take it anymore, we will go to other facilities as well. But we are hopeful that hopefully it's not going to be as bad as we anticipate and as we think it's going to be. At least let them decrease. But at the moment, there's no decrease.
In terms of your communication with the MEC, what was the final word then from the MEC? I mean, I imagine that you painted, the scenario that you're painting now and the concerns that you have. So what was then the final word coming from the MEC?
The final word that actually came to the MEC was to say we are ready to do what we did during COVID-19, to call all healthcare workers who are actually needed, from cleaners to the doctors. Let's call all of them and give them a contract of 12 months. That's what the MEC was actually talked about, to say we'll give them a 12 months contract, just to be proactive in a way. But I am going, as the MEC, going to go to the premier of the province, which is Panyaza Nusuf, and present this idea. And then we look into the budget. And actually, once we reach a consensus, we will then give the affected hospitals that are admitting currently, go ahead to call all those healthcare workers that are needed, because even the CEO of Jubilee Hospital was saying, if we can only be assisted in as far as human resources concerned, we will actually be able to rise above this challenge. The issue at hand is the material resources and human resources.
Rich, it's always a pleasure having you on the show. Thank you very much for giving us a full picture of what's happening there on the ground. That is Rich Sicina, is the Health and Allied Workers Indaba Trade Union president.